Hey everyone, I'm Nan here, and welcome to another fantastic episode of Digital Health on Air. I'm super excited to be joined by Omer Sultan. Omer is the Senior Vice President and Chief Financial Officer at the MD Anderson Cancer Center, and we all know that the CFO role has become incredibly important. It was always important, but for those operating at the intersection of health and technology, the CFO role is not very prominent. And so Omer sets the strategic direction for MD Anderson, long-term financial goals, and of course, he ensures that MDACC is really set up financially to continue to being world-class in terms of research, care delivery, innovation, so many things that MD Anderson Cancer Center does. And so we're super excited to have him with us here today to really talk about his role, the evolution of the CFO role, and really what are his priorities for 2025. So Omer, welcome. Thank you.
Adnan, thanks for having me. I should admit this is my first podcast, so hopefully not the last. We'll see.
Oh, awesome. Well, we're excited to be your first podcast. And I know this is actually one of our first episodes in the month of Ramadan, and I know you're observing. So happy Ramadan, Ramadan Kareem, Ramadan Mubarak to all of our listeners who are observing and celebrating Ramadan.
Thank you, Tim.
All right. So you've been the CFO at MD Anderson now for 4 years. And obviously, there's been a tremendous amount of change, just healthcare writ large over the past 4 years. Really help us understand how your role and priorities have evolved, and like what are the three or however many, but like let's say three things that were really top of mind for you when you started, and what are the three things that are top of mind for you now? Are they the same? What changed? But we'd love your point of view there.
Adnan, yeah, I'd love to start out and just by way of background, giving people
Please.
an understanding of MD Anderson and who we are. So,
Perfect.
MD Anderson, we're a well-regarded. U.S. News has us as the #1 cancer center in the country. Our goal is to be able to wake up every morning and do what we can to make cancer history. So that is the mission that drives 27,000 of our teammates that work at MD Anderson. Just in terms of size, we're 7.3 billion in operating revenues. We do about $1.3 billion in research spending, and we'll get into a little bit of that, I'm sure, in the later parts of the podcast. But what sets us apart from many other great academic institutions is that we are singularly focused on making cancer history. So we have 1,950 faculty whose sole focus is on cancer. So the breadth and depth of cancer care that you will receive here is probably amongst the few that's available in the country. We also are very proud to run the largest number of oncology-related clinical trials in the country, so almost 1,600 active trials at MD Anderson, which really serve as a differentiator for us for patients that come here for treatment care. So getting to your question, it's like almost like 5 years since COVID started. And, so I transitioned into my role at MD Anderson in the midst of COVID. I think when I first started here, it was all about the COVID and the rebound. And like many industries, right, we were facing that shortage economy, supply pains, I called it, as well as labor shortages. And particularly in healthcare, we've seen a lot of that labor pressure costs go up. Another thing, more strategically that I was focused on is MD Anderson during COVID had completed their strategic plan, but I was brought into the role to help develop a long-range financial plan that enabled us to help support and fund our strategy. So that took a lot of work. And like many, executives entering into a new organization, the third aspect of my job was doing a lot of sense making, understanding a very large and dynamic and a complex organization that does multiple things, all cancer related, but really trying to understand the key business drivers, how we deliver clinical care and research, and identifying those differentiating characteristics so that we were able to compete effectively in our space. So pivoting to now, some of those focus areas still carry over, and I'll tell you one thing that I talk to our leadership team and leaders across the organization about is really be focused on smart growth.
Mm.
As unfortunate as it is, cancer is becoming more and more prevalent in our communities. Through advancements, it's being diagnosed earlier.
Mhm.
And we are in a position to really be that place where patients want to come to get treatment. And so our focus is really on growing our scale, but also making it easier for patients to access us. And sometimes it's not the physician that they interact with first. It's
Mhm.
often somebody from my team who they're working with to get cleared from an insurance standpoint so that they're able to come and get their treatment. So really a singular focus on smart growth, but also we're all navigating, and I think particularly since January, this period of uncertainty. Uh,
Mhm.
with the change in administration, a lot of that is also impacting the healthcare industry. Just recently in February, the NIH pronounced that they're going to cut indirect funding, which had significant impact on institutions like ourselves and other institutions of higher education on research funding that we receive. So that how to mitigate that impact has been a focus. But also, one of the things that is exciting about my role is, how can we use technology to drive efficiencies throughout our care system? So from my standpoint, I look at core services or shared services and how to make those efficient. Our clinical leaders are looking at technology to make care more seamless, not only for providers, but the patients as well. So that's kind of been the focus. And you hear a lot about AI and machine learning and those types of things, but that is an area that's very much a focus for us as an institution as well.
Well, I think this is super cool, and it is directly in line with how we've seen the CFO role evolve. I mean, you've talked about smart growth, obviously ensuring financial viability, but then a real focus on technology and access as part of it too. And so that's my guess is a little slightly different than when you first came into the CFO role here or elsewhere. But maybe talk about your journey, and then because I think CFOs don't get to share their journey often enough. But share your journey and how that's equipped you for a current role, and then we can dive into more around technology and access to smart growth. I think those are super relevant themes that obviously are top of mind for you, but I think are top of mind for healthcare organizations across the country.
Yeah, I have a very atypical journey, Adnan. So I don't have the CPA following my designation, but I'm proud to say that I differentiate myself because I have a very diverse background that landed me into this role. So, like many South Asians, I started my undergrad thinking I would become a doctor. But soon in my undergrad curriculum, I realized there's a whole different facet to healthcare delivery that doesn't focus on treating individuals, but you have the ability to impact communities. And that was when I discovered this new field, late 90s, early 2000s of healthcare administration. So I doubled down in that and got my master's degree in healthcare administration and started my career off in management consulting, where I was working with the team to focus on large, complex health systems across the country, not only work on strategic activities, but also operational initiatives to make sure that they're viable and being able to serve their communities. So great experience. Highly recommend for those young careerists to look at consulting because it offers a fast and accelerated learning curve, but also gets you involved in various aspects of an organization from strategic setting, operational performance, and also understanding the fundamental financial drivers of an organization. Then life came, right? Married, kid on the way, and it was time to decide, you know, whether I continue to live out of a carry-on bag or do I bring some more stability in my life. And fortunate enough, I lived in Chicago, and Northwestern, one of the leading health systems there, had an opportunity for strategic planning exercise. So I started in their strategy group and helped develop the first joint strategic plan of Northwestern Memorial Healthcare in the Feinberg School of Medicine. So kind of working on an academic strategic plan. Through that, and I was able to meet leaders across the organization, and particularly in mind was the CFO that I was working with, who pulled me aside one day after a meeting and said, you know, you have a great grasp on the numbers. Have you ever considered working in finance? And I hadn't. And it was Pete McKenna, who is now the CFO at Baylor Scott and White Healthcare, pulled me into finance. And I worked on developing a mergers and acquisition strategy for Northwestern, who was looking like MD Anderson today, growing from a one hospital system to, when I left Northwestern, had become an 11 hospital system with over 8 billion in patient revenue. So participated in that growth and activity. And as a result of that growth, had the opportunity to step in as the CFO of the flagship hospital, Northwestern Memorial Hospital. Again, it's recognized on the U.S. News as one of the top 10 hospitals in the country. Working in that role was great because I was able to bring my financial acumen, but also work with dynamic physician leaders and clinical leaders to help accelerate Northwestern's trajectory in terms of delivering quality, safe, and effective care to over 45,000 patients that we serve. Then life throws a curveball, right? So one day I got knock on my door by the CEO of the health system and said, "Hey, I want to talk to you about something." And I'm kind of walking into his office nervously. He's like, "Don't worry, this is hopefully good news." And he presented an opportunity that was kind of one of those things where you're like, "Do I really want to do this?" He asked me to help Northwestern implement their first physician compensation plan redesign. So if you have doctors in the family, you know how money is important to them. And to, tinker with their compensation models is a risky thing. So I took a leap, obviously had the confidence of the CEO and my boss, the CFO at the time, to say, you know what, you're going to work in a hybrid HR and finance role and help roll this plan out. And because you have the analytical acumen, physicians trust you and you can help kind of see things through. So it was a quite interesting journey. My wife in HR, and I told her I thought I'd never work in HR, but I got a little exposure to it as a finance executive. We had a successful rollout of the compensation plan. I can safely say my tires weren't slashed and physicians still said hello to me. And so then I moved into the number 2 role in finance in the health system. And, a couple of years later, I had a phone call, one you don't expect, right? MD Anderson was looking for their next CFO. Didn't expect to be moving to Houston, but talked to my wife and family, and everyone agreed it's worth a try. And here I am 4 years later. So, at MD Anderson, it's been a great journey in terms of not only leading the financial planning efforts, but also seeing the strategic transformation under the leadership of our new CEO, what we've undertaken here. So really excited.
Amazing. Well, first and foremost, thank you for just walking us through what a super cool career journey and arc. And you shared it with such humility, but I mean, you kick butt wherever you've gone. So kudos and congrats. And MD Anderson is super lucky to have you. So let's dive into a topic and theme that's top of mind for lots of folks, but a lot of our listeners are CIOs of health systems, involved in various parts of a health system. You're the CFO at one of the most innovative, impactful, successful health systems in the country. How has the CFO role changed? And is there a common misconception about your role?
Yeah, well, number one is most of the CFOs don't get invited on podcasts. Maybe it's because of our personalities or something else. But I think the role of the CFO has definitely evolved. There was a time when CFOs were considered basically as the individuals that called balls and strikes, right? And from a strictly the perspective of telling people what happened but not about what's going to happen. And so I think that role and evolution has really become the CFO, becoming a really vital strategic partner to the CEO and leadership team on helping advance an organization's goals. So um, I also think, the role of the CFO has evolved because it's less about command and control. And if you think about it, it's more about cultivating and coordinating. Many organizations are matrixly oriented, so it's less about your ability to, draw in initiatives top down, but really to work across the aisle, across multiple stakeholders, internal and external within the organization. And that's where the CFO role comes in here.
Okay, cool. Well, let's stay here. You opened with very much a strategic operator point of view, right? In terms of smart growth, access, technology, not balls and strikes, right? And so, take us through like your approach for the rest of 2025, or and you can extend the horizon, but like help us understand like how you are acting as a strategic operator, and is there an initiative or a set of initiatives that you are really excited about?
Yeah, exciting and CFO don't normally go hand in hand, but I will tell you, what drew me to this job and, what's great about MD Anderson is there is a lot of demand for our services. And
Absolutely.
we are in a very humbled position by that because cancer is a devastating diagnosis to not only the patients, but their families. And we want to provide an end-to-end, seamless, and high quality and safe and affordable experience to them. So for us, we're fortunate to be in one of the states with a growing population. So we see that as a really strong opportunity to continue to diversify our presence, not only within Houston and Houston Metro, which has been our traditional focus, but last year we announced that we are going to enter into what I think is the most fastest and exciting markets in the country, Austin. So we are going to be building
Yeah.
a full comprehensive cancer center there in Austin. And so it's the first time for MD Anderson to, you know, from ground up, literally build something in a new city. And so our leadership team and our, uh, caregivers and teammates across the institutions are really rallying around that opportunity to deliver world-class care in the capital of Texas.
That's awesome. Okay, very cool. Okay, I'm going to ask you for your advice here. One is for CIOs or technology leaders, digital leaders. Advice for them in terms of where you've seen a partnership with a CFO work really well, and what if you're advising your CIO or a technical team, like what should they be thinking about in terms of delivering on their goals and strategies and things that are important to them?
Yeah, I think now that's a great point, right? Like there are, obviously as a CFO, you interact with executives across the organization, but strong partnership, I think, also has to exist with the chief technology, digital officer, CIO, that whole, portfolio, I think demands a lot of care and feed.
Yes.
And so a lot of investments come as a result. And to me, it's working with them, ensuring that we're making the right strategic bets and allocations and being able to look back on them to see how they're doing to either the start, stop, or continue the investment. So, I really, I'm fortunate to work with a great, CTDO who understands that and that we can work together to really deliver technologies that not only advance the clinical care, but also take out unnecessary waste within the organization. And that's a struggle because sometimes technology ends up costing more, support costs, all that
Totally.
TCO, total cost of ownership.
Yeah.
You have to really focus on, okay, how is this driving better bottom line performance? How is it reapportionating? We're in the fortunate position, right? We're not a for-profit publicly traded institution that's beholden to shareholders. Our shareholders are the communities that we serve, our patients. And so whatever we save on the back office we can put towards care delivery. And so I think that's a great rallying cry for us to make the right investments, not only in our technology infrastructure, but investments in general.
Is there a partnership there that like you're really proud of, like a certain initiative you're like, man, like we got to a 1+1=3 type outcome?
Yeah, there's one underway. It's called the AI opportunity, right? So
Yep.
working actually real time this week with, how to build that platform, because AI is a risky, adventure, especially in healthcare where you're dealing with people's lives, and not only that, with some of the regulations around patient privacy, et cetera. There's a lot of opportunity, and we want to look at that carefully and together, making sure that there's the right subject matter expertise in-house that can look at AI deployment and monitoring that deployment. So I'm working with our CTDO and helping determine what that base infrastructure need is to be able to evaluate, select, deploy, and see the the value proposition that is coming through the AI platforms that exist.
Awesome. Well, very thoughtful and practical advice. I appreciate that. Keeping on with that advice theme, believe it or not, there are many CFOs and financial leaders who are in our audience, so they're going to love this episode in particular. But your advice or approach you'd share for them as they're leading healthcare delivery organizations of all sorts of different shapes, flavors, sizes, geographies. But many of the themes you touched upon are probably top of mind for them. So your advice to them, approach that you'd want them to really, take away as they as they join for this episode.
So my team knows that I like to kind of keep things simple. So in that spirit, I call it the 3 Cs, right? Not the letter grades that we aspire to, but the 3 Cs that I'm referring to are CFOs or finance executives need to be great collaborators. And we don't want to be, as the CFO, I don't want to be known as the CFO, but how can we work together? So, right, collaboration, building that partnership, not only at the C level, but the finance teams also need to be strong business partners, understanding the business drivers and not just being, again, the ones calling the balls, those strikes, or saying, hey, you're running a budget variance type of thing. The second one is communication skills. There is, I think, apprehension towards finance. There is in healthcare because it's a very complex structure. But, again, I tell my team, it's not what you know, it's what your audience needs to know. And so you need to communicate at a level that they understand what you're delivering, but that they're also able to take action from what you're delivering. So we've looked at a number of reports that we produce and saying, what do these do to our intended audience? Is it a nice to know? Is it a need to know? Or can it be something, more importantly, that can be acted on to help drive better business results? So that's been a key focus of mine as I continue to advance the finance organization here. And then lastly, it's continuous improvement, right? As the CFO, you are looking at financial stewardship across the enterprise, and you need to be able to really drive the teams in how can we do things better. And I'm very fortunate at MD Anderson, we're always about pursuing excellence, and that means finding better ways to do what we're doing and delivering that back to the patients.
Well, awesome. I think collaborate, communicate, continuous improvement, an approach that's simple and clear and that we can all benefit from. Omer, this has been super fun. Huge thanks. I would never have guessed this was your first podcast. You're a natural. And this was one of my favorite episodes. So thank you for sharing your time with us. I know our audience will really, really appreciate this because this, as you mentioned, there's a lot of often misconceptions or preconceptions about the CFO, and I love your approach around like, hey, you're there to help solve real business problems and be a true partner and strategic thought partner. So thank you. This has been awesome.
Thank you. I appreciate the invite and opportunity, and look forward to staying in touch again.
All right, thanks so much. We'll see you.
Take care.
Bye, everyone.